What's up? I'm sorry. Thank you so
You Good morning, everyone. Good morning. Thank you all so much for coming out on this gorgeous morning. We'd all like to just be outside sipping a cup of coffee, but there's important conversations to be had, and I just want to acknowledge and appreciate you for being here to be part of that conversation. I'm Chris Cobbler. I'm the publisher and CEO of the Fort Worth Report, and we're just getting ready to celebrate our 4th birthday, April 10th. I can't believe it. Thank you all so much. I just came back from a journalism conference in Miami, national conference, and the Fort Worth Report, and Fort Worth, more importantly, was held up as a national example of a community that's really rallied around to embrace local news. And I was very proud of it, and proud of all of Fort Worth for our successes. So thank you so much. But I also want to thank a big part of that success, the Fort Worth Report staff. That we have an exceptional staff all around here. If you all would just sort of stand up or wave and let everybody know you're here. And then, of course, these live journalism, these events happen only because of our sponsors who help make all this journalism happen. It's free for everybody to read and access, and we believe in that as critically as part of our mission, but it's not free to produce. And so the sponsors that help us do that, our presenting sponsor today is JPS Health. So please let me acknowledge them. And we also have series food sponsor, North Texas Community Foundation, for all the great food you got and coffee you got to have this morning. Thank you so much. And then our series silver sponsor, the Real Estate Council of Fort Worth. Their table's here somewhere. And then also our series supporting sponsors, BNF Railway Foundation, the Mental Health Connection, United Way of Tarrant County. They are all just wonderful friends and partners of ours. And thank you so much. Thank you. I also want to acknowledge everybody who's been reading the Fort Worth Report. We are up to over 72,000 newsletter subscribers, which is remarkable. Again, when I was at this conference comparing to other nonprofit news organizations around the country, and there are over 400 because of this crisis in local news. Not a one, compares to what is the response that we're having. 72,000 newsletter subscribers, growing about 2,000 a month, over 375,000 monthly unique visitors to our website every month, and our membership, which is very important. We're up almost to 2,300 members, folks who are members or folks who donate at any level that's meaningful to them. And if you're not a member of those, I suspect most of you already are, but if you are, you can make a donation of any amount, and we thank you so much. It's really, really important. I also want to thank Texas Wesleyan for providing this beautiful space and introduce Dr. Messer. She's here today to say a few words. Dr. Messer, I saw her just a minute ago. There she is.
Thank you, Chris, and good morning. Welcome to Texas Wesleyan University on this beautiful day. What wonderful weather we are having. We are delighted to host Fort Worth Report and the Candid Conversations that take place. Thank you, Chris, and your team for all the work. And they are located just right across the street, so that's outstanding. Welcome to the esteemed panel. Outstanding things are happening at Texas Wesleyan right now. During the spring semester, we are experiencing a 6% enrollment increase in undergraduate degree-seeking students. So lots of interest in our university. I hope you get to see some of our outstanding students walking around campus today. But what a discussion today, mental health. Mental health to college students. We discuss it almost every day in our cabinet meetings, in our staff meetings, because that's what our students are experiencing. And how do we serve the students? Well, there are a myriad of ways and many other opportunities that we are exploring. But I do want to share the Texas Wesleyan University Community Counseling Center. I'm not sure if you're familiar with that. It is right across the street on Rosedale as well. And that is a community counseling center not only for our students, which provides free services to our students, faculty and staff, but provides opportunities for the community as well at a very minimal cost, typically a $10 charge for our community members to seek counseling therapy through our counseling center. And that is all part of our marriage and family therapy counseling graduate and doctoral programs. So outstanding opportunities for our community and our students. And of course, students also have the opportunity to participate in virtual therapy through Timely Care, which they really enjoy that. If you're familiar with that, I know it's a newer concept to many people, but 24/7 on-demand counseling whenever the students need it, whether it's midnight, 2 a.m., it's a perfect opportunity for us to provide that service to our students. So a timely topic. Thank you all for being here again this morning. I look forward to hearing the remarks and discussion. And once again, welcome to Texas Wesleyan. Enjoy your morning. Thank you.
Great. And I also want to give you an opportunity to hear from Dr. Karen Duncan again. Our JPS Health Network is our presenting sponsor, and Dr. Duncan has a few words to say. Thank you so much.
Good morning, everyone. I am a pediatrician, and I often came into the office saying good morning to you, but I will spare that. Not saying that to you. But I am Karen Duncan, often called Dr. Duncan throughout the JPS Health Network. And Chris talked about just kind of how Fort Worth has been recognized for their community work. But I would say that this is greater than Fort Worth. It really is Tarrant County. What we will hear today is all the work that is going on around Tarrant County as it pertains to the mental health crisis. I am incredibly honored to be part of Tarrant County. It is my why every day that I get up, is that Tarrant County is a county that really understands the community, sees their community, hears their community, and finds a way to care for their community. So when Chris approached us about sponsoring this, it was a no-brainer for us. And so thank you again, Chris, for the great work and the education of the media reporting out into the community about the great work that's being done. And today, I am really honored to be alongside some great panelists here today. And I want to thank, first of all of you for joining us, whether you are a provider of mental health services, whether you're an advocate, and probably many of you are community members. But I think all of you truly understand how vital and crucial this issue is around the mental health crisis. With that said, we today will hear from our amazing panel here. They are a very experienced group, and I'm sure that they will share with us their knowledge. They will exchange ideas, but more important, what I'm looking forward to are the new and innovative ways in which they will begin to impact this crisis. I don't think it's any surprise to us that Tarrant County is experiencing a mental health crisis. Suicide rates continue to be alarmingly high. And I'm sure all of us would say that one suicide is high, is too high, and that we've got to really begin with that one and ensure that zero occurs here in Tarrant County. And so how will we do that? We will hear that from the panel today, and I'm looking forward to that. With that, I'm going to again thank our panel here, and I'm going to turn it over. Let's get this show started.
Thank you, Dr. Duncan. Thank you for correcting me, too, that it is really Tarrant County, and we just celebrated our first birthday in the Arlington report. as well, too. So we've expanded across Tarrant County and continued to expand thanks to all the support we're seeing. I want to get one thing, though, is my cell phone. Here, Dr. Help me keep track of the time, but I won't take any calls. But I appreciate some levity in every situation. But this is a very, very serious conversation, and I want to definitely thank our panelists for being here. You'll notice we're missing one panelist. Lieutenant Harris is on her way. She'll be here soon and jump in as soon as she can. Appreciate all of you getting here. The traffic was really bad this morning too. But anyway, lots of issues, but we'll be here. And to set the stage for this conversation, as I've been talking to our panelists in advance and to lots of people as I've been researching this, you could go, it's such a broad topic, obviously, you could go so many ways with it. For the backdrop, to set the stage for everybody, in 2022, our loyal audience members here probably remember that we had a Candid Conversation on youth mental health care. And so today we want to continue that conversation, but with a focus on improving mental health care access for all adults in Tarrant County. And of course, what we try to do is really talk about local solutions. I think we can stipulate, everybody who's familiar with this topic knows that it's a national crisis, it's a statewide crisis, it's not just a Fort Worth or Tarrant County crisis. But that, when you think about it that way, you sort of feel hopeless, right? It's a national crisis, what do we do about it? And this conversation is really aimed at trying to talk about what's happening here on the ground in Fort Worth and Tarrant County, and where there's reasons for hope and ways that you all can get involved. So that's how we're starting this conversation. So I wanted to have each of our wonderful panelists talk about, first introduce themselves and talk about the work that they're doing briefly, but really start with the question of what we talked about our pre-panel discussion of a specific example that helps in their work that'll help everybody understand how serious this issue is here locally. So we'll start, Chelsea, if you want to start your first remarks.
Okay, can y'all hear me? Good morning. My name is Dr. Chelsea Angelosi. I'm a psychiatrist in the area, board certified, and I train locally at JPS, so I'm very familiar with the culture and the resources locally. I have nothing but wonderful things to say about JPS, and I try to still stay involved. I was there last week lecturing the residents. In terms of what I do right now, I'm in private practice, kind of in the west side of Fort Worth.
Great. And is there one specific example that you want to share that in terms of issues that you really struggle with? Or
Yes, thank you, Chris.
Yeah.
A lot of times it's the wait for me. Being in private practice, I cannot clone myself, and you can only have one place at the same time. And so in terms of wait times, it's difficult. I will often pick up additional hours or get additional people in just because the need is there. So I think for me, it comes down to we need more psychiatrists, and I know at our local level we are working on that. Within JPS's residency, since I was there only 2 years ago, we had expanded our program significantly and very quickly, and I know they're continuing to do so. From that level, there is change happening right now, which is a huge positive. And then retaining people locally is also important as well. I know from my class, pretty sure all 6 of us stayed local. So in one way or another, they are impacting our community, which is really, really important. So from my specific standpoint and my training, that's where I'm seeing it happening right now.
When you talk about the wait, how long typically might someone who decides they need help and be waiting to get that?
For the outpatient, depending if you're going through the private measures versus an insurance model, but at my practice, it's about a 1.5 month wait. It's just myself, but that can go all the way up to 6 months that I've seen in the community, and that's not unheard of at all. What's really frustrating, as you know, when somebody finally decides to take that step to ask for help, they're hoping it's going to be now. And when they make that call, they make that step, and they're told, sure, we'll see you in about a 1.5 months. It can be devastating. And so mental health does not wait, as you all are aware of. And we need better times to get people in.
Right, yeah. We want help now, not a 1.5 months or 6 months from now.
Right.
All
said, but also, I think there's a lack of navigation resources and knowledge in the community of resources available. And then also stigma that impedes individuals wanting to reach out and seek help. It's still frowned upon, and it's still thought of a failure in character or a failure in morals, or you're just that person over there that's not quite right. And they don't recognize this as a true medical illness. People do not decide when you're very little that I want to be mentally ill when I grow up. It doesn't work like that. No one chooses this lifestyle. No one chooses this disease. And so I think those kind of cultural, socio-economical issues and norms really impede a person and their family's ability to reach out and ask for help, and then secondly, to know where to go to ask for help.
Yeah, you might talk just a little bit more about how you see that stigma played out here as people come out for help at JPS or anywhere else, because that's so true. I mean, mental health touches everyone in some way, shape, or form, but is there any example of that you see, or anything you can elaborate on?
Well, for us, we do both inpatient and outpatient, and we also have the psychiatric emergency room. But how we see it playing out is people don't ask for help, and then all of a sudden it's a crisis. Whereas if you ask for help earlier, or the family recognizes and asks for help sooner, things can be very treatable in an outpatient setting. It doesn't have to reach a crisis. And whether people want to acknowledge this or not, when you have a loved one in your family with mental illness, it is a family illness. And so the family needs to be the one oftentimes to help intervene and get them to the help that they need until they're able to see they need to be there for themselves.
Thank you. And Michelle, please introduce yourself and tell us about the work you're doing.
Good morning, everyone. Lachelle Goodrich. I am the founder and the executive director of CHAMP, which stands for Community Healing and Mental Health Project. And it was birthed out of the need for the community response to the killing of Tatiana Jefferson. And so if you would ask the question of what I see or the need or the lack of access, is really we need more culturally competent therapists, that people feel safe to process their feelings and emotions. Then that way we can address the stigma. That way we can address the trauma, the family illnesses, and so forth. And so, again, we need more culturally competent therapists, and so people feel like that they can come and talk and navigate mental illness, mental wellness.
Mm-hmm. And so when you talk about culturally competent care, can you help us talk about an example of that where it's not available, how that adds to this crisis that we have?
Yeah, so it is not, I get plenty of text messages, DMs, social media, all of the things. For some reason, I'm seen as the community counselor, and so people just want an easy way to navigate. We talked about navigate. So if I have Medicaid, does that mean I have insurance? Does it cover behavioral health? Those questions. And so what me and my team, what we try to do is we provide plain language to say, hey, you can call this number on the back of your insurance. If you have Medicaid, that is insurance. Because a lot of times we get phone calls that say, hey, I don't have insurance. And so after that continues to happen, I say, hey, well, do you have Medicaid? People are like, yes, I do. We have, Aetna Better Health or whatever the case, then you have insurance. And so helping them navigate either the online portal or bringing
and some of my graduate students from UTA and other universities across the city, and having them to be the navigator. So they are able to help them navigate, calling the back of the insurance card, you know, hey, when you call the therapist, ask, hey, do you accept this insurance, or what is your wait time? What do you specialize in? And so giving them that language allows people to feel safe and educated when they pick up their phone to call a therapist.
Yeah, that navigation, we talked a lot about that in our pre-panel discussion, and it seems so overwhelming to people. They finally want to get some help, which is a huge step, and then they don't know how to navigate that help at all. And Chelsea, you had some thoughts specifically, you all did, we'll get to that, but I thought about how we in Tarrant County might do better with that.
Sure. During our pre-panel discussion, we were just discussing the difficulty in accessing care. You get on Google, you're Googling mental health, you're Googling a psychiatrist, and there's not one-stop shop that explains the different levels of care, where to go, where to call. For example, MHMR has the eye care line that has really helpful resources on it. JPS has our psychiatric emergency room, inpatient, there's a lot of services there. But how do you get to that next step, and how do you know which level of care is appropriate for you? We don't have a central resource or information website, handout, anything for the community to have a starting point. And so my proposition was that we create one. We have a lot of resources in the area. I think one of the big issues is people navigating it and understanding what the resources are. For example, IOP, PHP, that sounds like a foreign language to a lot of people. And I forget, and so I'll be saying, well, we could do PHP and IOP, and they just look at me and I'm like, that's weird, you have no idea what that means. And so explaining things with kind of a dictionary approach as well. What does that mean? At what point am I in crisis? Of course, it's when safety becomes an issue, but people don't understand that. So having a dictionary, some sort of central database for people to have access to, that when they Google mental health Tarrant County, it pops up. And when you Google that now, there are several resources, but it's not all collaborative together. It's still pretty siloed. So I think we are able to put all those resources together. I think it's something we could do as a community.
Zillian, JPS obviously it serves a wide audience, and you work with MHMR and the Mental Health Connection. I mean, there are lots of different agencies going at this, but what are your thoughts on navigation and what we can do to improve?
Well, I think Chelsea's idea is an excellent one. It's like one-stop shopping for mental health, a repository of all the available resources across the county. You know, and having it broken down. What is IOP? Well, that's intensive outpatient treatment, or partial hospitalization, or signs and symptoms of various mental illnesses, so that a patient can potentially say, oh, that could be me, or their family members, that could be me. And I think it's education and training in the community, and navigation of those services. But I think a lot of folks, because of the stigma attached to mental health and mental illness, they probably would like going on the website and looking for themselves and diagnosing themselves. Can we have tests, you know, do you have anxiety? Do you have panic disorder? Do you have major depression? If this shows yes, this is what you need to do, like an algorithm.
Right. And Michelle, and we talked along this line too about how people don't understand the different providers too, right? And if you might talk about that and your thoughts on navigation, how people know we can help them understand who they need help from.
Right.
Yeah.
So you have your therapist, which I'm a LPC supervisor, so licensed professional counselor. Sorry for throwing out those acronyms. And then you have your psychiatrist. Your psychiatrist is the one that can prescribe medication. And so the difference is training and education. But then you also have your community advocates that are your first aid mental health advocates, where they can provide resources. However, on the therapist side, we are the ones that I would say this is where you started. And so being able to identify triggers, identify positive coping skills, but also get to the root of the cause. If it's looking at family and childhood issues and trauma. And so we process and we teach you how to process feelings and emotions and all those great things. However, we also can assess and diagnose. If there is a diagnosis that we feel that you may need medication, this is where we will refer you to a psychiatrist, or because very limited, then there are psychiatric nurse practitioners, and so that is another route where you may be able to be seen a little earlier than the long wait, and so then they can be able to prescribe medication if needed, and we can work hand in hand, and so we can do medication management, and then give them the language as well as the skill to go back to their psychiatrist and say, hey, this is how my body is feeling. And so we're on the same page. Hey, it takes about 21 days for this medication. I want you to really be in tune with your body. Journal with your body. How are you feeling? If you're erratic or if you're sleeping, all these things. And then take that information back to your psychiatrist. So, because one thing for me, I want to educate and teach my clients to be their biggest advocate when it comes to their mental health as well as their health. Because when we go into those doctor's office, we become nervous, right? And sometimes, the world has taught us that they have all the answers. But if we don't feel brave enough to say, well, that's not quite how I'm feeling. And so a personal example for me is I have really bad sleep anxiety. Well, they just wanted to keep giving me sleep meds. I'm like, I can go to sleep. It's just this brain comes on, and I had to say, listen, you're not listening to me. That's a problem. I need something that is going to assist in this area. Finally, I found a psychiatric nurse practitioner that says, listen, let's navigate through a couple of things, and guess what? We can sleep at night. So, teaching all of my clients to be their biggest advocate. Your doctor is there to work with you. Yes, they have the knowledge and education, but you know about your body. And so, are you sitting still enough to say, I wasn't feeling like this 2 weeks ago. However, I've been taking this new medication, and it's been 3 weeks because they say 21 days, and I'm still feeling off. Let me go ahead and reschedule an appointment so I can do a follow-up.
Right, thank you. Thank you. Well, ahead of this conversation, as we're promoting it, we asked our audience for questions, so I've compiled a lot of great questions from those. So I want to start with one of those questions. Audience member asked, how does Tarrant County's mental health care system compare to counties of similar size nationwide, and what specific lessons can we learn from areas that have improved mental health access? So I don't know, Chelsea, if you want to start with that in terms of lessons learned that we could learn, or what other areas of the country are doing it well?
Sure. When we look at us compared to the rest of the country, we're unfortunately not first. We are one of the last states in the United States in terms of access to mental health care. This is not new information. We've known this, and we've all been working on this. States that exceed us would be a lot of the Northeast, states like Massachusetts, Vermont. They have better access to care, and a lot of times that's what it comes down to. Number one, insurance coverage. Here in Texas, we have a high percentage of uninsured, specifically those with mental health struggles. There's an even higher percentage. So when we think about coverage, we think about access, there's not as many facilities, programs here as, for example, some of the states in the Northeast.
Are there, and Zilly, you might want to jump into that, but are there other counties with similar challenges that have responded well, or any thoughts on that? Zilly, or just jump into lessons learned, I guess.
There are not other counties in Texas. And actually, there's several large metropolitan counties in Texas. Tarrant County is not one of them that are on the list for worst mental health care in the country. And I think, Chelsea, you hit it on the head. It's about lack of insurance coverage. It's about the provider shortage, and I don't mean just psychiatrists, I mean psychologists, All of those levels of clinicians that can intervene and assist people in a mental health crisis or reaching out for help. There is a huge shortage across the country, but the shortage is even bigger in Texas because the population of Texas continues to grow at a very fast rate, and Tarrant County in particular is a very fast-growing population, and literally we are not able to keep up with the demand. But again, I do think advocacy, policy advocacy is something that we as citizens in Tarrant County can become more involved in with our legislators, with our state senators, local representatives, and advocating for more funding for mental health in Tarrant County with whoever that may be, but to have more state dollars come to Tarrant County, because Tarrant County in and of itself spends a lot of money on mental health care in Tarrant County, believe it or not. And it's those state dollars that are not coming into Tarrant County that could be utilized by nonprofit agencies and health systems across the county to implement or expand existing services so that your ability to access services becomes greater and your wait time becomes less. And so I think advocacy is a huge role everyone in this room can be a part of, especially with our legislators, because that's where it really happens, is at the state and county level.
Right, legislature's in session right now.
Yes, it is.
Any particular legislation that you feel is that you're hoping will
Yes.
come through?
Well, I'm hopeful it would come through, but there is one piece of legislation that the Texas Hospital Association is supportive of, and we are too, and that is to expand what Medicaid covers and have Medicaid pay for intensive outpatient therapy and partial hospitalization treatment, because right now that's not covered by Medicaid. And so providers out in the community that have those programs will not accept people who have only Medicaid or that can't pay out of pocket. And so there again is a barrier to access. JPS does have IOP and partial programs in our outpatient programs, and we are not charging people who have only Medicaid because we know they can't pay for it, but JPS is also not getting reimbursed for those services either. And, if you really want to treat the patient in the right place at the right time in the right location, you've got to have access to all services. And for someone who's in crisis, partial hospitalization or intensive outpatient treatment could be an intervention that keeps them out of an emergency room, which is a higher cost to Medicaid, and keeps them out of the hospital, which is even a higher cost for Medicaid. So let's be smart with our dollars.
Makes sense. Lachelle, go ahead.
Yes, I'm itching over here. Okay, so, thank you. There has been 3 counties in the state of Texas that has improved or enhanced their mental health access through initiatives. So look across this room, look around the room. It's about the money. Where is the money? And so, and not, yes, our state and all the things, but let's look at the big insurance companies, and they should be required to issue grants to, whether it's grassroots or other nonprofits that are providing mental health, right? Because none of it is free. None of us can go to our doctor and it is free. And so you have Amarillo, which is Potter County, has had a long-standing mental health care shortage, but state lawmakers allocated $26 billion to support their hospital and expanding mental health services. You have other counties, and again, it goes back to the money. The money. And so we have to make that investment. One of the things that the nonprofit Champ is doing is we provide free up to 8 free counseling sessions to not just our youth but also to their family members because of lack of insurance. And so even on our private practice side, so I have a private practice which is our legacy consulting and counseling. If they don't have insurance or there's no coverage, we try to see if we can cover that on the nonprofit side. And so parents do want help for their children. People do want help for themselves, but if they feel like they don't have the resources to pay for it, then that becomes an issue. And so I just rather not deal with it because I don't have the resources. So there are some counties in Texas that are improving, but it goes back to the money.
Well, you're on a roll, Michelle. There's another audience question I wanted to set you up with is how can Tarrant County make the most of limited dollars to provide mental health care? And you might talk about what you're doing with your mobile unit that's out front right now. People saw it, but please tell us about that.
So leveraging community partnership, we have to improve that more. And so one of the innovative things that we've done is we have a mobile mental wellness unit. And where it has 2 parts. We have one where, and guess what? It's outside and y'all can take a look. You can do a walkthrough, and so we're definitely excited. But this is where we can have some group education and counseling sessions. This is where we can have one-on-one. If there is a crisis in the community, then we can do a 48 to 72 hour triage. Before we were going out to communities such as Como, the South Side, Las Vegas Trail area, and we were providing these services. Now we have a mobile unit where we can take this out, not only provide triage services, but education to the community. And so this is part of us wanting to eliminate the barrier for transportation. I don't know about you all, but telehealth services, they are thebomb.com. So if I say anything that happened that was good out of COVID, it was being able to access telehealth. And so to this day, we still use telehealth. I have mothers that have children. They're like, okay, their dad is in the house. I'm going to my car and we're going to do this counseling session. I'm like, as long as we're not on Bluetooth and they can't hear us outside, then we're good. As long as we're not driving. And so again, being able to have the mobile mental wellness unit, we can also be able to do telehealth services in that particular unit. So we're excited about that. There is a part 2, a more innovative piece to it, but we'll talk about that another day.
All right, thank you, Deanna. And Zelia, you were talking in our pre-panel discussion about the walk-in clinic at JPS, which I was interested to hear. Some of the folks were not really aware of that. You might, obviously, it's a free service, but it's not free to do, right? JPS. Right. You might just talk about that. It's like local news.
Yeah. First off, I want to thank my team for setting up a resource table out front, and I really encourage everybody to get some literature. It lists all of our services, all of the important phone numbers to contact, where to go, what to do, and those type of things. But so at JPS, we do have our psychiatric emergency center. A lot of folks think that the only way you can get into the PEC is by the police, and that's not necessarily true. We have on the front side of the PEC it's a walk-in clinic, 24/7, 365 days a year. Anybody in Tarrant County can come to JPS, come to the walk-in clinic, and be seen by a provider, evaluated and treated with a prescription, if necessary, connected to community or our outpatient resources in approximately 1 hour and 17 minutes. 24/7. 365 days a year. And I'm very proud to say that we also, at a couple of our outpatient clinics, have walk-in clinic capability as well, so that anybody can come into our outpatient clinics, walk in, and be treated. Not everyone has to be hospitalized because you have a mental illness. So So JPS last year had 18 plus thousand visits in our psychiatric emergency center. That's a lot. Only 28% of those individuals required an inpatient hospitalization. A mental health crisis is a now kind of thing. It's a now for the individual, it's a now for the family or the neighbors. It's a now type of thing. But most crises with time and appropriate intervention can be de-escalated so that someone is successfully treated with counseling, with a psychologist, with medication management, not within the four walls of a hospital. And we're very excited. We just opened our new medical home Southwest. And so we have obviously the medical care there, but we have a brand new huge behavioral health outpatient clinic. And that clinic will have walk-in capabilities also. And then we are in partnership with Cook Children's for the Las Vegas Trails medical home. And we will have behavioral health in that clinic also, child, adolescent, and adult. And then we're building a brand new psychiatric emergency center that's not only built for today's needs, but built for future needs as our population continues to grow. And what I love about it is families won't have to navigate the hospital to get to the PEC. Families and patients themselves can literally drive yourself to the door. We'll meet you at the door and say, welcome, let me help you.
Thank you. And thank you, Lieutenant Harris. I have another question for the rest of the panel. I'll let you catch your breath before I give you a question.
I apologize for being late. I got stopped by the police.
I like it. The other, another audience question was, what training can or does our community provide to adults so they can identify and refer cases? In our pre-panel discussion, Matt, the CEO of the Jordan Elizabeth Harris Foundation, which is a wonderful resource in the community, talked about how we can improve care through just the community. And obviously, Jordan Elizabeth Harris Foundation, if you're not familiar with it, you should be familiar with it, but it really helps a lot of school-age children, and this topic is not about school-age children, but the earlier, it is about, how we earlier identify issues and treat them early in the process before their emergency room or their police issues, right? And so you might talk about, maybe let you, Chelsea, start that in terms of how Tarrant County is doing in elevating the community's role in mental health care access.
Sure. I think it really depends on the entity that we're discussing, whether this is a place of worship, a church, a community center, a school, but most groups have their own protocol or resources in place, and they often do a fantastic job. I think, again, the issue is knowing about these resources and being aware within your own community. So I think that would be one thing today to take away is to be curious. What are the resources that are within your network of people, whether it's your church, your book club, your whatever your community is, but what do those people know about resources and what resources are available? Because the majority of those organizations do have options. I just think people are not aware of them.
Right. I'm really struck by what Matt said in terms of, it feels like big numbers, but if you really think about the people who are most in need, we can get our arms around them and help them if we do the right things. Lachelle, I know you're in the community at work because that's really where you're focused. You might talk a little bit about that in terms.
Yeah, we continue to go back to navigation, and I see one of my community partners, Cook Children, here at the table. I sit on their ACEs task force committee. We've changed the name, can't recall it. But one of the ideas that came up with was to create, and this is for mental health for youth and parents, really education. We created a road map, literally a road map, where if you see these or identify these behaviors within your child, this is what you do. Not only did we create a tangible road map, we created mini videos. And so I spoke from as a therapist that talked about stigma and how there There's no handbook when you're raising children and they are stricken with crisis or mental health, right? And so then you also had community members and parents, and they spoke from different perspectives of mental health. And so it can be simplified with roadmaps. It can be simplified with partnering with community trusted messengers and putting out the message. JPS, wonderful, all the things, right? And so with Zelia, we were on our pre-pan. I was like, yeah, for real? I didn't know that. And so for me, it is, how are we getting that message out there? It is partnering with CHAMP, somebody that the community and regular folks see on a daily basis, and I am speaking that language and I am putting out that message. If it is a quick social media video, that's how we're getting people to realize, okay, my child is in crisis. This is where I need to go. If it's, we have the Best Parent app, Parent Pass, that information also needs to be there. Social media can be our great friend, but I think just going back to the basics of things, how do we have a roadmap to say, if this is what, I don't care if it's interactive, if it is whatever it is, and then these videos that are educating our parents and then working alongside with trusted community messengers.
Right. Well, let's introduce Lieutenant Harris now, Lieutenant Kimberly Harris. If you would, please tell a little bit about Arlington Police Department and some really important work that you're doing. And then the question leads to, after you do that, introduce yourself, the question that leads to is, should law enforcement, or how should law enforcement's role in responding to mental health crises evolve? Should it remain integral to intervention, or should the focus shift to community-based mental health professionals? It's a tough one to answer, but first just introduce yourself, Lieutenant Harris.
I'm Lieutenant Kimberly Harris. I'm the commander over the Behavioral Health Law Enforcement Unit, Blue. We've been in operation for 2 years, but we've been doing this work for longer than that in partnership with MHMR Tarrant. We paired clinicians with cops in 2012, and they have been riding around in Arlington. A couple of years ago, the city decided, hey, let's kind of embed a unit within the police department. We were able to show that 1 in 10 calls that police respond to have a behavioral health component. 1 in 10. On any given day, officers may go to a call, they may have 20 behavioral health calls within the city of varying degrees. So they were able to staff a unit, and they started out a little small, gave me 4 and 4, and had me pair up crisis intervention specialists that have training, and some have licensure in crisis intervention in behavioral health and counseling, with specially trained behavioral health response officers. They're my bros that I have out there. And I still have about 36 that are on patrol that ride out with clinicians from MHMR. That is an ancillary unit. They're out on patrol every day. So they're out there with specialized training. We have quarterly training, and we hold them to the fire when it comes to knowing the mental health laws and knowing the current research on mental health treatment. So the unit started, it's been extremely successful enough that they gave me more people. And my deputy chief is here, Steve Williams, who's been a huge help in speaking for me in command, because sometimes I can get a little hot with the topic. The reason that you cannot take law enforcement out of behavioral health intervention, there's 2 reasons. The first reason is, yes, if we had groups of people that would go out in the community and go to every location, on every situation, that'd be great. The reality is we just don't have that, because we can't say no. Fire, police, EMS, we cannot say, you know what, that just sounds a little weird. I don't think I'm coming to that call. So we have to respond. We have to respond, and it's okay. I signed up for it. The second reason is something that I don't think it gets enough attention about, but 40% of people with bipolar disorder and 50% of people who have schizophrenia have a symptom called anosognosia. It's a real word. Anosognosia is the belief that nothing's wrong. Okay, and if you think about that, we are their therapist. They may not see someone coming in because they're a therapist. They're from MHMR. No offense, they're from JPS. They are psychiatrists. But they will talk to me, and if they don't talk to my people, they'll talk to my clinical person who rides out with my officer. We ride out, we don't ride out in uniforms. We ride out in different kind of uniform. We don't have marked vehicles that say police, so the neighbors aren't looking out their window. And we try to destigmatize, we try to humanize, and we've been able to get a lot of people on that path toward mental health. We have, through this program. And so those are the reasons police will probably never be out of the loop on that. And the second, unfortunately, is safety. Sometimes these individuals, because of the behavioral health, they have weapons, or they are so fearful that they're going to lash out at anybody they foresee as wanting to hurt them. And so sometimes, unfortunately, we have to be able to match that with in-kind force when we work with them.
Yeah, the result of all these issues is that across the country, sadly, our jails and prisons are the #1 mental health care provider. And that's where you'll find the most patients, the most help being provided. So it leads to the next question the audience member I had was about the Tarrant County's jail diversion program, how it's working, where it can be improved. You may start with that, Lieutenant Harris, and then we'll let others jump in.
So there's a couple of diversion programs. One is there's the Tarrant County Diversion Center, where we take low-level offenders such as trespassing, which is what we see a lot of, the trespassing. They're in a place they're not supposed to be in. And instead of jail, we take them to a diversion center where they're surrounded by people who are going to get them on the right track to get care and help. That's the first diversion. The second diversion is we are talking with people who come through our Arlington jail, and we call it a detour program because I like naming stuff. And so the detour program actually meets with individuals in jail that are there for certain crimes, and they may have a behavioral health component, including substance abuse. Can't forget that. And we try to divert them into diversion courts so they don't have that on their record. They don't have this as kind of a mark, and they have another chance for diversion. So we're real invested into getting people out of the jails and into treatment where they belong.
If you could wave a magic wand with that, any increased funding there in that area that you would like?
Absolutely. Absolutely.
Yeah. Well, let's, and we're starting to wrap up the conversation. I would love to keep going on this because there's so much more to cover. But let's talk about one solution, or several solutions, but just go through the panel. What, if there's this magic wand notion, what could we do immediately or with the magic wand, either way, more practically? Chelsea, what are your thoughts on a key solution?
I think navigation, starting there. We do have a lot of resources that people are just not aware of in the community, and I don't think it would be a very difficult project to take on. Sounds like y'all have done it with the child adolescent side of things and given them a roadmap of where parents should go, and we could do that for adults and across the board as well. So I will volunteer myself to help that, and if anybody else is interested in compiling resources for easier access, I think that would be a very easy place to start.
Thank you, Chelsea. We're very interested in working with you on having that on our website and being a resource for that too.
Happy to.
Thank you. Zelia?
So I think the one thing, definitely navigation, but also education. Education to the community, to families, and individuals who have a mental illness. We do a lot of community outreach at JPS. Elizabeth, raise your hand. Elizabeth is our community outreach specialist, and so if y'all need her, come to your area, please see her afterwards. But like I said, education that mental illness is medical illness. It's a brain disorder. your neurons and synapses and electrons, they're misfiring for whatever reason. That's a medical illness. It is not a failure of character. It's not a failure of your belief in God. It is not a failure of you. Anyone, anywhere, anytime can have this brain disorder. And so we've got to educate people about this. We've got to educate people about navigation, like Chelsea said.
Yeah, on that point, I think it'd be useful to ask the audience, who here is, dealing either personally or with a family member or close friend that's dealing with some sort of mental health issue? Yeah, and yet, right? Everybody, that stigma exists. But I think that's a point to make. So thank you for that. Michelle, what solution are you thinking about?
Solutions, I have 3. But I'll keep it quick. Leveraging telehealth services, strengthening community partnership. We understand that MHMR Tarrant is the mental health authority. However, we also understand that they cannot do it all. JPS cannot do it all. And so strengthening those community partnerships is definitely a must. And then utilizing mobile units for outreach and education as well as services.
Thank you. Thank you. Kimberly?
My turn, okay. All right, check this out. When we go out on calls, a lot of times we only have 2 options. We can leave them there, or we can take them to JPS under a notification of emergency detention. And they don't always like that. And sometimes it's not always the best for the person, because being forced to do something, it's hard to start that way. I would like to see a facility that is an unlocked facility where people can go and actually go and have crisis respite, maybe get evaluations, look at getting, doctors, psychiatrists, counselors, social workers, a team of people, even dental. Some of these symptomologies come from sometimes dental issues, right? So just kind of a wraparound area. So if we were to buy a hotel and we were to staff it, yeah, we have different levels of care, then I think that people would be more likely, you want to go to JPS and be locked up? Do you want to go to jail? Do you want to stay here where you're just in stress all the time? Or do you want to go to a place where you can come in and you can actually get heard by the individuals instead of going in and out of emergency rooms and no one's listening? So I would just like to see some kind of option for that in Tarrant County. That's my vision.
That's a really, really interesting idea, and it makes a lot of sense, because a couple of the other questions we had from family members, I could tell from the question was, why is it that if I'm trying to get help for my family members having a severe crisis, it seems like the only alternative is for them to be locked up involuntarily, or voluntarily, and I have no control, right? As an adult, dealing with an adult, we might talk to that issue about the law, what the law says in terms of a family member, whether they do or don't want their family member locked up, and what the law allows you to do.
So that's what, I get that a lot, because people say, how come it is police? How come police? How come it's not, social workers? How come, psychiatrists, mental health professionals can't just do that order and place people in a hospital? The main reason is because this action falls under the 4th Amendment, which is freedom from illegal search and seizure. When you take someone into custody and they can no longer leave and they can no longer have a choice, it's a seizure. It's technically an arrest by police. And that's the reason it's under that police element. However, if there's reason to believe there's a behavioral health condition, if there's reason to believe that because of that behavioral health condition, they pose a threat to themselves or other people, and if that is imminent, not immediate, imminent, it could happen without without treatment, without intervention, then we're able to take them to get assessed by a doctor. We don't admit people to the hospital. They have to see a doctor. That's all we do. That's all it does. The community has another option. They can approach a magistrate. We have mental health judges. They can approach a magistrate, complete information. Psychiatrists can fill out what's called a CME, and they can get someone in the same situation seen by a doctor. And once that's issued by a judge, it's called a magistrate's order. The judge gives it to a police officer or mental health deputies in Tarrant County. They then go and seize that person. So that's the reason it falls under law enforcement, because it's a seizure.
Let's close with a lightning round of, we'd like everybody to walk out thinking with one thing they can do to make a difference in their access area. Chelsea, what would be one thing everyone could walk out to?
I would challenge every single person here to get curious, to think how you can be the first example to spread awareness, education, and to look for resources. Mental health touches every single person in this room, whether it's yourself, your loved one, a child, family. And so I would get familiar with the resources in the area, and Kimberly had a great point. There is, how do you get help for a family member? If it's an emergency, you don't want to be in that situation and not know what to do. So I would challenge you today to just do the research and figure out what you would do if you were in an emergency, and become more familiar with some community